We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist, and we're talking about how healthy are you really, and are you getting routine checkups? Rebecca, welcome to the Dr. Bob Show.
Thank you for having me.
When we talk about a complete physical, what do you mean?
A complete physical can mean different things at different points in your life. As a child, going to the pediatrician, it's measuring the head circumference and talking about developmental milestones, getting a lot of vaccines. As you get to be a young adult, physical exam will focus more on disease prevention. As you get a little older in life, it tends to be more disease management. So it's going to mean different things at different points in life, and I like to call a complete physical almost like a routine yearly checkup. And it's important to do that. First of all, you need to have a physician-patient relationship. It's nice having a physician to go to when you're sick, not having to go to someone who doesn't know you well, who doesn't know what medicine allergies you have. It's nice going to someone that you have a physician relationship with. And it is also good to talk to your physician when you're not sick and talk about those things that will help keep you healthy for the rest of your life.
Is that a lot, when you see patients, is a lot of that counseling then on how to stay healthy later on, what you should be doing? And
It is a lot of what we do.
Is there any certain age group you think a complete physical or a yearly checkup is more important? It seems like it would be important as a young child and as an adolescent and as an adult.
It is. It's important throughout life. I would say probably for a young male, ages maybe 18 to 39, very healthy, not many risk factors, maybe a physical every 2 years, and a blood pressure check is what's really needed every 2 years. But if there's a family history, for example, of premature heart disease where one of the parents has dropped dead at the age of 40 or so, then that person actually may want to get a physical exam every year, checking cholesterol and blood pressure, being a little bit more careful about following up on those things.
When I think of a yearly checkup, I think of a history, a physical, and laboratory work. Which one of those three do you think is most important?
The history by far is the most important. They all are useful, but the history is important because the history will help guide you through the physical exam and necessary labs. For example, if you came to me with chest pain, I would want to focus very much on the cardiac exam and the lung exam, and I might order an EKG and a chest x-ray to follow up on whatever symptoms and findings that you have. But if a female came to me and she had no symptoms, but she had a family history, for example, of breast cancer, then I would focus in on the breast exam and maybe order a mammogram. So the history is going to help guide you through those other two.
When you do a physical exam, I want to walk through certain parts of the body and tell people what you're looking for and think about. If somebody gets a blood pressure, what's normal blood pressure?
A normal blood pressure is 120/80.
And if it's elevated, what do you think of as a physician?
If it's elevated, you want to think, could this be heart disease? And so you want to focus in on the heart exam and you want to get to the risk factors. High blood pressure is often associated with high cholesterol and an elevated blood sugar or even diabetes. And that is something that we call the metabolic syndrome. Happens as we age and put on weight. And so that's one of the things that you would want to focus in on.
Now, we spend a lot of time feeling the neck. Do you just feel for lumps and bumps? What do you feel for in the neck on a physical exam?
Well, thyroid gland is important to feel for. It sits in here, and the thyroid gland, if it's underactive, can actually lead to a high cholesterol and many other symptoms as well. Also, you want to feel the carotid arteries, the pulse, and if there's a pulse pressure difference, it could mean there's a blockage somewhere. Also want to feel for lymph nodes, could be a sign that there's infection or inflammation from higher up in the head.
So the neck's pretty important. When you listen to the chest, if somebody's got cancer, can you hear that in the lungs?
No, you cannot hear that on the lung exam. But the lung exam can help you, maybe if someone's got asthma or chronic lung disease, you might be able to pick up on that on a physical exam.
So there's certain things, physical exam of the lungs, that can tell you. When you listen to the heart, does that mean you can tell the heart's perfect or there's no heart disease just by listening?
No, you cannot. Sometimes it can clue you in, but often the heart sounds just fine, and and there are problems.
But then what are some of the things you can find on the heart? If you listen to the heart, are there some problems that you can find?
There are. You want to listen to the rhythm of the heart. A skipped heartbeat might mean that there's an electrolyte problem, like a low potassium, abnormal thyroid. You want to listen for murmurs. If there's a murmur, that would be turbulent blood flow going across the valve. The valve may not be opening or closing well, and so you want to listen for that because that can cause symptoms. A faint murmur is okay, but a loud murmur is never normal.
What do you are thinking when you examine the abdomen? What are you trying to feel there? Can you feel anything other than just a soft old tummy?
You can. It's hard sometimes, but you can. The liver is what you're trying to feel for. See if the liver is enlarged. Might give you a clue that there are some diseases there. The spleen, trying to feel for the main blood vessel that goes down the center of the body, that's the aorta. Feeling for tenderness somewhere. For example, tenderness above the pubic bone might indicate a little issue with the bladder, maybe a bladder infection, so you're feeling for those things.
So all these things on the physical exam very important. Your history leads you to where you want to concentrate on.
That's right.
What you said. Now how about a pelvic exam or a rectal exam? Does that have to be part of a complete physical?
Not at all phases of life for everyone. Men don't need a rectal exam really before the age of 40 unless there's a problem or an issue. Sometimes between the ages of 40 and 50, depending on their family history, rectal exam, definitely a rectal exam from 50 on up for males because you want to check the prostate and you're also testing for blood. Now the best test for actual blood is going to be a colonoscopy because what you're really looking for there is colon cancer. For females, a pelvic exam with a pap smear is really recommended for the age of 21 through 40, really probably almost every year for most women, so that is important.
When we get lab work, is it always just blood work, or are there other things we want to get to, perhaps?
There are other things you may want to get, depending on what was found on the physical exam. For example, if you did hear something unusual with the heart, you may want to get an EKG.
What is an EKG? What does that tell you?
EKG, and it's an electrocardiogram, and it looks at the electrical activity of the heart. So it's going to give you an idea of, is the electrical activity going through the heart in a normal way? If there's damaged heart muscle, it won't go through normally.
So it can tell you if you've got some damaged heart. It does give you the rhythm like we see on television,
Yes,
bleep,
it does.
bleep.
Yes, and it tells that as well.
So it's a very, very important part. When do you decide if you want to send somebody, get a stress test where they get electrocardiogram while they're exercising?
Well, just like you can listen to the heart and it sound normal, you can look at an EKG and it looks normal. On the other hand, someone is having symptoms that maybe you're alarmed about. Often, of course, when you're in the physician's office, you're not having those symptoms, so it may not show up on the EKG. A good time to make those symptoms manifest themselves would be on a stress test.
So you can go further and further in your testing depending on what the history and
That's right.
what your feel for that patient was. Tell me about blood work. What blood work do you get?
The blood work that's important are going to be blood sugar, especially looking at the person's history, maybe their body size, their family history of diabetes runs in the family. That's certainly something you want to check.
If you get an elevated blood sugar, do you use 100 or use 120, use 126?
We use 100. So a blood sugar anywhere from 70 to 100 is considered normal. Up to 124, 25, we call that abnormal glucose. Higher than that, we call that diabetes.
Just one time, you get it fasting. If they just get it one time, do you check it 2 or 3 other times? Or that makes the diagnosis. If it's greater than 125, it's diabetes.
Unless they cheated and ate something that morning. Yes, that is the diagnosis.
And then if somebody does have an elevated blood sugar, then you've got to counsel them on diabetes and the problems with that and getting their weight down and exercising, those type of things. So we've got a blood sugar.
We have cholesterol. And with cholesterol, we're looking at the overall cholesterol, triglycerides, which are one of the fats of the cholesterol, the good cholesterol, which is you want that in balance with the bad cholesterol. So good cholesterol helps kind of eat up the bad on the arteries. The bad cholesterol is the one that builds up plaque on the arteries.
What can you do if the cholesterol is elevated?
Once again, the diet and exercise is a very important part.
Nothing like it, is it? It really
right.
helps almost all. So we've got fasting blood sugar, we've got cholesterol. Any other blood work that you like?
Depending on the age of the male, a PSA is a prostate-specific antigen test, and it's looking for prostate cancer. And that's usually done at the age of 50 and older. And if there's a family history, you might want to do it a little sooner than that. So those are what's usually done. Now, if someone is on a medication, for example, if they do have a high cholesterol and they're on cholesterol medication, you would want to check the liver enzymes or liver tests, and those are a panel, and those come on the panel. If someone has high cholesterol, it may be, once again, I mentioned this earlier, the thyroid may cause a high cholesterol. So you want to check that, and especially if there's a family history of an underactive thyroid. That's very hereditary.
So you really got to fit everything together
Yes,
with
you
the
do.
history. That's what it really makes it fun, taking care of people, isn't it?
Yes, it does.
How about mammography, colonoscopy? Talk about those for me.
Mammograms are indicated, most physicians will do a baseline between the ages of 35 and 40. After 40, most physicians will recommend that one is done yearly up until the age of 50. Some will say every 2 years. Everyone agrees that at the age of 50 and above, women need mammograms yearly. So for colonoscopies, we get those at 50 as a screening test, unless there's a symptom, and of course we'll get it earlier, for example, rectal bleeding or change in bowel habits. Also, if there's a family history of colon cancer. Say, for example, if I had, my mother, for example, if she had colon cancer at the age of 55, I would want to get my colonoscopy at the age of 45. So that helps guide you in that screening test.
Test for osteoporosis, for bone density?
That would be done on women who are going through menopause or postmenopausal. Once again, you get one as a baseline. If it looks good, then you may not need one for another 5 years or so, unless there's what we call a pathologic fracture, and that would be an unusual fracture where you're falling on something soft and you break a bone, or you sneeze and you break a bone. Then you might want to get a bone density at an earlier age.
Anything else that comes to your mind on routine physical, routine checkup? We've got an electrocardiogram, colonoscopy. What's the osteoporosis test? What's that? DEXA scan?
Yes, the bone density.
Okay, so the DEXA scan, colonoscopy, mammogram, mammography. So we've really taken care of the patient pretty well unless something unusual comes up. How often do you ask that person to come back? Usually
we will ask them to come back next year, unless they're extremely healthy, like I mentioned, that 18 to 39-year-old, and then maybe they can come back in 2 years. But usually we'll have them come back on a yearly basis, unless something was abnormal on their exam or on their blood work. We may have them come back sooner. I did want to also say that vaccinations are important. I mentioned those in childhood, but actually there are some adult vaccines that need to be updated periodically. And as you turn 50 and older, flu vaccine is recommended, pneumococcal is recommended at 65 and older, and now the shingles vaccination is...
The Zostavax.
Yes.
Do you recommend Zostavax for people over 60?
I do if their insurance pays for it. If it doesn't pay for it, it's one of those things I'll sort of let the patient decide. But it's a
terrible problem to get when you get shingles.
It is a painful disease.
Rebecca Jackson, you're a wonderful teacher, and it's so important that people get their yearly physical. Thank you for coming and teaching us exactly what to expect. I hope you'll come back.
Well, thank you. Thank you for having me.